Hey everybody, this is Paul from Ortho Eval Pal, and what I wanted to do is a video to complement the most recent podcast that we have done on bunions. And bunions are very common. I just want to talk about some of the causes to bunions, what a bunion is, discuss that, and talk a little bit about how do we treat that. They can be very difficult to treat because they come on over a long period of time. Okay, so if you take a look at this young lady here, you'll notice that there's some redness here, so there's pressure in the shoe. The problem with the bunion and why a bunion occurs is that the toe is meant to go up and down into flexion and extension, but with her flat foot, tight calf, she's putting pressure over here on the medial side of that toe, on the inside of the toe, and you'll notice that there's quite a callus here. That callus happens because of shearing force, so instead of pushing off on the bottom of the toe, she's pushing off on the inside of the toe. So having that callus there tells us a little something. It tells us that she's getting this inward or outward pressure like this. As a result, it stresses and strains the tissue on the outside of the joint, and the joint opens up. And as a result, that makes it look like a bump there, okay? But it's really an instability that is happening here. And the other thing that can happen is you can develop some bony spurs because of the abnormal pulling on the bone in that direction. So therefore, this part of the foot will appear to become wider and will take up some pressure. As you can see on her foot here, there's some redness. She took her shoe off about 4 to 5 minutes ago, and it's still quite red. So one of the things that we've noticed is that, and that we see quite commonly, is the longer leg or the foot that has a flatter foot will develop a bigger bunion and have more valgus in this toe. So if you take a look at her when she stands, I'm going to have you stand, Rebecca. You'll notice that this foot flattens out significantly where that one does not. Look at how much straighter this toe is, and look at how much this one curls in. So when she steps off, she's stepping off on this part of her toe, whereas this one she's stepping off on the bottom, and there's a very, very small callus here compared to this one. Okay, so I'm going to have you sit right back down. So how do we treat this? She has orthotics in her shoes, so what we try to do is support that arch so that the toe moves into flexion and extension a little bit better, and we like to support this first metatarsal so that it holds the foot up a little bit more, because when that drops, as you can see, it curls the toe outward even more. The other thing we want to do here is we want an orthotic. Actually, I'm going to pull that one right out of your shoe. We want an orthotic that stabilizes the heel and cups the heel, as you can see over here, because there's some pretty good evidence showing that when the heel drops out, the whole foot drops out, and then this toe has this outward pressure also. So I'm really big on doing an orthotic for people who have bunions and hallux valgus to prevent it from getting worse. You can do a night splint if the toe is correctable and you can pull it off to the side like that. You can get a splint that holds the toe in this position. But the reason I don't do that with patients very often is that you're in a non-weight bearing position. And so as soon as she stands up and puts that pressure on her foot, that is just going to overpower this toe and still push it inward. So that's where I think an orthotic is better and more beneficial. I also have these folks stretch their calves out, because when you have a tight calf and you can't bend the ankle back, you have this tendency to turn the foot outward more in order to clear it. And when you do that, you put more pressure on the inside of that toe again. So stretching the calves, a good orthotic, and then if that doesn't work and this becomes too painful, you may need to have surgery. I'm also a big advocate of getting a shoe that is wider and deeper so that there isn't too much compression on the bunion and causing that irritation, because there is a little bursa in here, and that bursa is a fluid-filled sac that can get bigger and get inflamed and irritated. So getting a shoe that is wider and deeper can also be very helpful in this situation. And again, surgery as a last resort to manage this. Well, I hope you enjoyed the video. If you like it, give us a thumbs up. And if you have any questions or want to make any comments, leave that in the section below the video. And thank you very much for watching.